Are you starting, or do you want me to?
You're starting.
Because I'm afraid I'm not seeing. Hello, everybody. We will be starting in a few minutes. In the meantime, if you would like to introduce yourself in the chat, that would be great. Thank you. And somehow I'm not seeing the chat at all myself, just so that my colleagues can see that.
Welcome to your meeting with ICM. The interpretation button should appear at the bottom of your screen, next to the Share Screen button. By clicking on the interpretation button, you can choose the language you would like to hear. The interpretation button will then transform this meeting into the selected language. To change the language you would like to hear again, follow the previous procedure by clicking on that same button. By default, you will hear the selected language at 80% volume and the original audio at 20% volume. If you would like to mute or unmute the original audio, click on the corresponding option within the language button. Enjoy your meeting. Bienvenue à votre réunion avec l'ICM. Comme la réunion propose une interprétation simultanée en français, le bouton Interprétation devrait apparaître en bas de votre écran à côté du bouton Partager l'écran. En cliquant sur le bouton Interprétation, vous pouvez choisir la langue que vous souhaitez entendre. Le bouton Interprétation se transforme alors en la langue sélectionnée. Pour changer à nouveau la langue que vous souhaitez entendre, suivez la procédure précédente en cliquant sur le même bouton. Par défaut, vous entendrez la langue sélectionnée à 80% de volume et l'audio original à 20% de volume. Si vous souhaitez couper ou supprimer l'audio original, cliquez sur l'option correspondante dans le bouton de la langue. Bonne réunion. Bienvenido a su reunión de la ICM. Como la reunión ofrece interpretación simultánea en español, el botón Interpretación debería aparecer en la parte inferior de su pantalla, junto al botón Compartir pantalla. Haciendo clic en el botón Interpretación, puede elegir el idioma que desea escuchar. El botón Interpretación cambia entonces al idioma seleccionado. Para volver a cambiar el idioma que desea escuchar, siga el procedimiento anterior pulsando el mismo botón. Por defecto, oirás el idioma seleccionado al 80% de volumen y el audio original al 20%. Si quieres silenciar o desilenciar el audio original, haz clic en la opción correspondiente del botón de idioma. Disfruta de su reunión.
Can you now? Sorry.
Okay, that's great. Would you move to the next slide? Thank you.
Okay.
Hello, everyone. Welcome to the webinar today, the last in the series of webinars that we're running from ICM this year. I'm Sally Pearman, the Chief Executive of ICM, and I'm very happy to introduce you to the panel of speakers that you have today. And I'm just going to ask each of them to very briefly introduce themselves and really what you can see on the screen, who they are and where they're from. So let me start with Jane. If you wouldn't mind just saying hello, Jane.
Hi, I'm the lead lecturer for the International Bridging Programme at the University of British Columbia.
Thank you. Nyla?
Hello everyone, I'm Nyla from UNFPA Pakistan office.
Fantastic, thank you. Marianne?
Hi, hello. I'm Dr. Mariam Sarfaraz, and I work at the Ministry of Health in Pakistan. Thank you.
Thank you. And Steph?
Hello everyone, I'm Steph Marriott, Midwife Advisor for the ICM based in The Hague. Lovely to see you all.
Thank you. Next slide, please, Bruno. So as with the last webinars that we have been running, this webinar is also coming to you as part of the AIME group, or the Alliance to Improve Midwifery Education. And this is a collaboration that started a couple of years ago in 2021. It was established with core stakeholders that you see on the screen: UNFPA, ICM, Leerdal, the World Health Organization, JPIGO, and the Liverpool School of Tropical Medicine. And all of us are the kind of core partners of AIME, but there are some 3,000 others involved who are on a mailing list. And AIME is really trying to collaborate, to share information about midwifery education, to coordinate efforts, prevent duplication, and so on. And so this is as I say, the fourth webinar, and we hope that you look that this is a very positive one again, as the others have been. Next slide, please. So today we're focusing on recognition of prior learning, or RPL, and Steph will talk to you about all the other names that there are for recognition of prior learning. We're going to look at the case study, several case studies, 2 case studies, one looking at how RPL is used in a pre-service midwifery education program, and another one looking at how RPL is used in a post-registration bridging program for international midwives coming to Canada. And then we want to ask you also about if you know of RPL experts and how they can be involved in helping us with future work on recognition of prior learning. There will be an opportunity at the end for questions and answers. You can use the Q&A button at the bottom of your screen to post your questions, and if necessary, you can put them also into the chat, but we will have time for those. And I think at this point I'm handing now on to you, Steph. The next slide.
Thank you, Sally. So one of the reasons that we're here today is to talk about how recognition of prior learning links with midwifery. So there's some key facts on the screen. I know that you all already know them, but one is looking at that. We know that midwives can provide 90% of sexual, reproductive, maternal, newborn, and adolescent healthcare. And with that, of more than 60% of maternal and perinatal deaths. But midwives only make up 10% of the workforce providing sexual, reproductive, maternal, newborn, and adolescent of the workforce. And there remains a deficit estimated to be about 900,000 midwives globally. So what we want to look at today is how, by increasing the number of midwives, reducing that deficit, we can increase the number of midwives in practice, improving the outcomes for women and babies everywhere, and achieving the Sustainable Development Goals. Next slide, please, Bruna. So as this webinar builds on the previous AIME webinars of the year, a good starting point is to place where recognition of prior learning sits within the education element of the ICM's professional framework. So you might be familiar with this diagram from previous webinars. So the ICM's global standards for midwifery education provide a framework for pre-service midwifery education, and they provide the framework for the education element of the professional framework that you can see on the slide. and they look at 6 different areas: program governance, faculty, students, the program and curriculum, resources, and quality improvement. And category 3, which looks at students, focuses on how we recruit students, supervise them, and provide policy for them. And there is a line within that that discusses there being a mechanism for taking account of prior learning. What we're going to do now is look a little bit at what recognition of prior learning is and how it's beneficial for midwifery. Next slide, please. So before we get into the definition of recognition of prior learning, we're going to start with some other definitions. It's important to identify what is meant first by the concept of learning. So there's 3 definitions on the slide. Firstly, formal learning. So this is structured, intentional learning achieved through programs or courses at accredited educational institutions and or recognized by a regulatory authority or professional organization. So this might include certificates, diplomas, or degrees in the case of midwifery, in midwifery. For non-formal learning, this is also intentional, but is gained through participation in organized workplace-based training and workshops, but does not generate formal credit. So this might be short workplace-based courses or annual training, such as on newborn resuscitation. And then we have informal learning, and this is incidental learning from life experience, workplace-based tasks, and volunteer activities, or self-directed learning and study. This might be a single aspect or an entire role, such as is seen with traditional birth attendants. Next slide, please. So another set of definitions I want to look at is, before we define recognition of prior learning, is the difference between a midwife and a midwifery associate, because we're going to make reference to the cadre of midwifery associates throughout this presentation. So as a reminder, the ICM's definition of a midwife is a person who has successfully completed a midwife education program based on the ICM Essential Competencies for Midwifery Practice and the framework of the ICM Global Standards for Midwifery Education, recognised in the country where it's located. So they've acquired the requisite qualifications to be registered as a midwife and use the title midwife, and who demonstrates competency in the scope of practice of the midwife. So this concept of competency was discussed in the previous webinar of the series. Midwives are also a member of the WHO Skilled Health Personnel Providing Care During Labour category because of their competence in providing maternal and newborn health. A midwifery associate, on the other hand, is a title used by the International Labour Organization. So in their International Standards Classification of Occupations, or ISCO, to describe someone who provides basic healthcare and advice before, during, and after pregnancy and childbirth. So they implement care, treatment, and referrals, but those that are established by medical, midwifery, and other health professionals. But there's a wide range of examples globally of positions which are classified by the definition of midwifery associate. So we might have maternity support workers and traditional birth attendants. And this range is really large, as we have people with different learning and experience backgrounds grouped together. And this is a consideration we're going to come back to later in the webinar. Next slide, please. So what is recognition of prior learning? Well, ICM's definition can be found in the Global Standards for Midwifery Education, and we define it as a procedure or process whereby students are assessed and may be given recognition for past learning and experience relevant to current enrolment in a midwifery program. So you might have heard the term when recognizing the process of transferring partway through a pre-service midwifery education program, but actually this is just a small part of RPL. And although prior experience is part of the RPL process, it's important to note that it's the learning gained through experience which is being assessed, not just the experience itself. Next slide, please. Thank you. So if you're not sure if RPL is something being utilised in your context, some examples might help. So RPL is utilised when a student transfers nationally or internationally between pre-service midwifery education programmes, as I said before, but it's also used sometimes as a supplementary admission criterion for midwifery associates, such as in apprenticeships or condensed courses, which Pakistan are going to explain shortly. We then have 0 semesters or access to healthcare study courses, whereby additional formal learning can be undertaken to ensure an applicant meets the admission criteria of a programme. And ICM are primarily focusing on RPL for pre-service midwifery education, but there are opportunities for it in bridging programmes between professions or countries, which the case study from Canada is going to discuss in detail. Next slide, please. So recognition of prior learning is called different things in different contexts and countries. So if you're not sure already if RPL is something that you're utilising, then maybe these alternative names might help. It's not an exhaustive list on the slide at all, but all of them include the principles of RPL. So we have things like assessment of prior experiential learning, or APEL. We have prior learning assessment and recognition, and validation of non-formal and informal learning. And advanced standing is also a term used for which includes some aspects of recognition of prior learning. So next slide, please, Bruna. So we're now going to ask you to be involved. I'm hoping that we can post in the chat also the link to this. So we'd love to know, what do you call recognition of prior learning in your setting? Because I think the list I shared isn't necessarily the same as what you're doing. So there's a chat, there's a link in the chat, or you can use the code at the top on the Mentimeter website, or scan the QR code and just write in what name you're using for the process of recognition of prior learning in your context. RPL and APEL. And then also think of that if you're not using it, then maybe you're not in there. But we seem to have lots of people that have been using recognition of prior learning, bridging. We're going to talk about this. Clear, APEL. Fantastic. Well, it's great to see that there's lots of overlap, that lots of people are using recognition of prior learning. Apprenticeships, yes, fantastic example of apprenticeships, a way that we're able to move people from midwifery associate positions to midwives. Great. So you can continue to add things to the Mentimeter or even into the chat box if there's other titles that you're using. But next slide, please, Bruna. Thank you. So I'm going to talk now briefly about what the benefits of recognition of prior learning for midwifery education are. So firstly, RPL provides a mechanism for people who would not be able to access pre-service midwifery education programs based on formal education criterion, and this includes midwifery associates. For midwifery associates, but especially, but for some other applicants too, RPL optimises a midwifery education programme So we might add components such as a 0 semester to ensure skills, for example, mathematics, are adequate, so students are well prepared for study, or by reducing the duration of a programme as applicants have already achieved some learning outcomes through prior learning. Additionally, if applicants already have experience in sexual and reproductive health, it's anticipated that they're more likely to remain in the profession once they are registered as a midwife. And this is especially important in underserved and marginalised communities where midwives from that community are then supported to remain there. So next slide, please. The other benefit of RPL is as a tool for social justice. So as this slide shows, in marginalised and underserved communities where access to formal education might be limited and where pre-service midwifery education programmes have only formal education as the admission criterion, this limits access to those with a desire to be a midwife from that community, meaning that there's fewer midwives in the community and results in poor health outcomes. But when recognition of prior learning is applied, community members with a desire to be a midwife who will likely have informal education and extensive experience in providing SRH, there is a mechanism to be educated as a midwife and subsequently improve outcomes for women and newborns in marginalised and underserved communities. So now I've spent some time introducing the concept of RPL, why it's of benefit. I want to look at a couple of case studies before moving on to consider best practices. So next slide, please. So I'm now going to introduce Dr. Mariam Sarfraz from the Ministry of Health of Pakistan and Dr. Naila Yasmin from UNFPA Pakistan to present how RPL is being used. Over to you.
Thank you very much, Steph and Amy, for giving us this platform to discuss and present the recognition of prior learning approach we are taking in Pakistan. If I can have the next slide, please. And yeah, so just to set a little bit of a context, because I see there are people from very many countries here. Pakistan is a large country. We have a huge population. You can see these numbers on this slide. And we're also devolved, and the government setup we have is devolved and decentralized. We have a very high growth rate. You can see we have nearly 6 million births per year. And along with that, we also have a high maternal mortality and an infant mortality rate, mainly because of lack of midwifery services or compromised midwifery services in the country. Next slide, please. So a little bit of statistics about our country. High birth rate, high total fertility rate, resulting in very many births happening across the country in almost all the regions. We also have high maternal mortality, and to complicate things, we have another problem that we have nearly 70% of the births attended by a skilled birth attendant or in a facility, because that's where we can prevent the mortality and the morbidity among both women and children. Next slide, please. So to really look at the issue of why we are investing now and focusing on recognition of prior learning, especially for midwives, is coming up from the issue of our crisis of health workforce in the country. We have medical and nursing and allied health professional colleges who are producing these HR in the country, but there are two problems. One, the production quantity is not enough to meet the growing needs in the country. And second, a lot of our doctors and nurses are moving to other countries because there is skilled worker migration going on, and very high demand of nursing in many developed countries has taken away quite a lot of nurses. If I can just draw your attention to one fact that we have the production ratios are also skewed in our country. We have 4 doctors to 1 nurse, which is a ratio opposite to that which is recommended by the international standards of WHO or whatever organization you look at. if I can draw your attention to the nurses, lady health visitors, which is an associate midwife and midwives in Pakistan, we have 141,000 registered in the country, but we need at least 760,000 to be working in the country for the population and the need and the demand we have right now. So if I can have the next slide, please. Our issue is mainly the lady health visitor in our country. The associate midwife is called the lady health visitor or the community midwife. Their numbers are small and they work at the community level, but we need them to be in the hospitals and not drop out from the health workforce. So keeping that in mind, we have started working with at 3 different levels. Next slide, please. And these three levels include education, they include the leadership and the governance, and they include bridging programs. So in terms of education, we have introduced the Bachelor's of Midwifery program in Pakistan, which is recognized by our Higher Education Commission. It has been based on the Essential Core Competencies from the ICM 2019. If I can have the next slide, please. So in terms of the leadership, governance, and regulation in Pakistan for nursing and midwifery, we used to have, till last year, we had the Pakistan Nursing Council, which was also registering and regulating and licensing the midwives. But earlier this year, through an act of parliament, this organization, this regulatory body, was renamed as the Pakistan Nursing and Midwifery Council, with a whole setup and a governance structure put in place for midwifery education and the services quality and regulation. We have, in terms of education, we have 2 main types of programs going on. One is the 2-year program, which is focused on the development of the associate midwives and for provision of the essential healthcare services. And the other is the 4-year program, which is a comprehensive degree program offering advanced clinical care. In terms of the bridging programs, this is something which is being developed for allowing or facilitating the re-entry of associate midwives to the bachelor's programs and to make them more productive and bring their years of experience into the mainstream. And the other thing we are working on in terms of, again, a bridging program is with the Higher Education Commission. I will hand over to Dr. Naila on the next slide. So if I can have the next slide, please. So Dr. Naila, over to you for the continuous professional development and career pathway work.
Thank you. Thank you so much, Dr. Mariam, and thank you, ICM. So for this BS Midwifery program and overall for the midwifery as associate midwife, continuous professional development was going on, but it is in bits and pieces, like some of the donor funding or through government funding, these trainings were conducted. But in the last year, we have developed a continuous professional development plan where we have taken the technical support from Barnet University, Australia as well. So now this CPD for the midwifery tutors is going on for the implementation, and these have different multiple steps. And we have reached up to 2 or 3 steps yet. It is recently started. The implementation of CPD is recently started. So one thing that we are enhancing the skills as well as the knowledge of these midwifery tutors, because we have a challenge as well of the shortage and the competencies of the tutors. So with at least for the CPD, which we have started, is that at least the knowledge and competencies, we can say that that can be enhanced for the midwifery tutors that can cope with the for the associate midwife as well as for the BS midwifery program as well. As BS midwifery, we have started recently. So along with this CPD, we are also working on the career pathway so that the associate midwives, they are already part of the health system, and they have their rules and regulations, their job structure and everything. For the BS midwifery, with the ministry and with the departments, with the authorities, with the regulatory body, the career pathway is also started with, so that they can be mainstreamed. after their completion of their graduation, and they have multiple pathways in that, maybe on the education side, management side, as well as on the primary or secondary or tertiary level care facilities. For the BS midwifery and also for the associate midwife, the career pathway is also given along with the education towards the BS midwifery. So another point, which is the scale up of the midwifery, yes, there is a need in our country that we have the competent and well-educated midwives. So the government is also thinking on and willing to scale up of the midwifery in all of the provinces to start with, and the development partners and the donors and UNFPA is supporting for that as well. So next slide, please. So the picture here is the first batch of the BS midwifery we have in Pakistan. So for the this qualification framework from the higher education for this graduation program is like the competencies we have, the number of credit hours, the duration of the program, semesters and total semesters, and then the courses per semester and all these. So this slides define these both things for the competencies as well as for the requirements and the criteria. Next slide, I think this is the last slide from our side. Thank you.
Thank you so much, Naila and Mariam. So great to hear about the recognition of prior learning process in place in Pakistan. If anyone has any questions for Naila or Mariam, you can put them in the question and answer tab at the bottom and we can come to them at the end. And I'm now going to hand over to Jane Wines, lecturer at University of British Columbia in Canada, to hear about how RPL is working there. Over to you.
Thanks. So, as we said, I'm the lead for the Internationally Educated Midwives Bridging Programme at the University of British Columbia, which is an orientation course for qualified midwives that are immigrating to Canada. I'll give you a little background on the course before talking about the RPL to give some context. So no matter where an internationally educated midwife wants to work in Canada, they'll have to take an orientation or bridging programme. We assess a midwife's knowledge and clinical skills, orientate them to our model and scope of midwifery, and help prepare them to take on a primary provider care role. Upon completion of the course, the midwife can apply for registration with the Regulatory College of BC, and they can then practice full scope midwifery. Next slide, please. The Canadian model of care is quite unique. Unlike many countries, we're not associated with nursing. We're part of the university's Faculty of Medicine and are medical staff in hospitals. Midwife work from community clinics as autonomous primary care providers in small groups of up to 4 midwives. All care from when the client or patient knows they're pregnant to 6 weeks postpartum is provided by a midwife they know. When they go into labour, they will have a midwife they know through birth and postpartum. All care is evidence-informed and clients have the right to informed birth choices and decision-making. This includes place of birth, so midwives must be confident in providing home births. The level of autonomy and responsibility is at the same level as that of a doctor, and many international midwives find this, as well as honouring informed choice decisions, new and challenging. Next slide, please. So the programme is divided into 3 terms. In term 1, midwives can join a once-weekly 4-hour Zoom class from anywhere in the world. We use case studies to learn about the role and scope of the midwife in Canada and address differences in clinical guidelines and systems of care. They have several online modules to complete and essays and exams to take, which all amount to about an extra 10 to 20 hours of homework a week. In term 2, the midwives will join us in Vancouver for their intensives. During this time, we review some basic skills and theory. For example, not all midwives worldwide suture, support active birth, or prescribe a wide range of drugs. They also take a comprehensive exam, an objective standardized clinical exams, or OSCEs, on clinical skills and knowledge of our model. In term 3, the midwives are placed in a community midwifery practice for 13 to 20 weeks. Here, they're truly immersed in Canadian midwifery, and they need to demonstrate that they can work at least to the level of an entry-level midwife. The assessment tool we use is the same one as we use for our graduate midwives in BC. Because of the nature and the course and the challenges of working in Canada, it's essential that we thoroughly assess the midwife's education and experience. Next slide. So we do this by having a rigorous assessment process. It starts with the online application where midwives must outline their relevant education and clinical experience, and this process covers all types of learning. We ask for statements about their educational process, their philosophy of care, and a little about their midwifery career. They'll then send the verification forms to their schools, referees, and regulatory authorities and pay their assessment fee. Two trained assessors review the documents for every applicant, and the course lead then reviews the file and assessment reports. Sometimes the assessors will request more evidence, which the applicant must submit before the application proceeds to the next stage. The assessment process also checks for the authenticity of claims and documents. Assessors check the timelines and claims make sense. For example, are they claiming to have far more births than expected for that period of time, or do they claim to provide care that would not be common in their jurisdiction? Then the interview takes place on Zoom and is usually about 2 hours long. We only interview the strongest applicants to select our final 16. The interviews are the course lead and one other midwife, usually another internationally educated midwife, where possible, comes from a similar background to the applicant. We ask clinical questions looking for solid basic theoretical knowledge, critical thinking, and clinical management skills. We also ask about why they want to immigrate and what preparation they've made so far. If we're not this rigorous, we risk bringing in midwives who will not succeed, which would be a huge personal and financial expense to them. But we also have an obligation to protect the public's safety. So we know that doctors, nurses, and other healthcare workers have been accepted into the workforce with fraudulent papers. So we must guard against this in midwifery. Next slide, please. To assess eligibility, we review each midwifery education program the midwife has taken. We need information on the primary qualifications so we can assess the following. Was the institution accredited and recognised in the country it was offered? Who are the faculty? Where did they train? And what's their experience? For example, we've had schools where we've reviewed there's only 2 or 3 faculty, all of whom graduated from the programme they now teach in and who don't appear to have educational qualifications or experience outside of the programme. And this would be a concern for us. We obtain verification of the clinical and theoretical hours, and if it's a post-nursing or naturopathic qualification. And then when reviewing the curriculum, we need to see that there are clearly defined competencies and outcomes. It must cover all aspects of care throughout pregnancy and postpartum for parent and baby, teach that the care is provided on their own responsibility, and it must not be equivalent to obstetric nursing. There must be a good framework linking theory to practice, and supervised clinical placements should be in a regulated jurisdiction, and we examine how clinical preceptors are sourced, trained, and linked to the school. For example, if a student has to find and pay for their own preceptor, and the school has no link to that preceptor, we would consider this a concern. Care must be provided in the language of the population served, so the clinical placements should not be in a setting remote from the school. We need to see they teach the fundamentals of evidence-based care and how to read and interpret evidence, and we look for a robust and fair evaluation process. The programmes that do not meet our requirements may well prepare good midwives for the setting they're in, but we know they'll not be able to work in our model without more support and teaching than our course can offer. Next slide, please. So the clinical practice requirements are that the midwife should have worked at least 5 of the last 10 years, or have been recently educated, or have at least 100 births as a primary midwife, and worked where midwifery is regulated. They must also have met their regulatory requirements for ongoing education. Next slide, please. We're careful to verify all of the experiences the applicant claims. So we obtain the educational materials from the school or the schools where the midwife trained. We also require a report from the World Education Services Canada, which can confirm the institution's standing further, and they also compare the qualification gained to a Canadian equivalency. For clinical experiences, we must have at least 2 references from colleagues or managers who can confirm the number of births the midwife has at their institution and the other clinical tasks included in their role. And we need a reference from the current or last clinical employment. Registration and good standing are confirmed directly from the regulatory authority for every jurisdiction the midwife has ever worked in. Next slide, please. So we may still consider midwives for the programme if they don't meet our criteria. For example, if they've extensive clinical experience or have taken further education in midwifery or a master's degree, for example. We do offer examination as a route of entry for some. We also see and are likely to see more midwives who cannot access the verification documents. So this can be because of war or natural disasters, political changes, which means that documents cannot be obtained or no longer exist. For these, we'll then look further afield for evidence. This could be other colleagues, clients, community groups, religious groups, and anyone who can provide verification that this is a genuine experienced midwife who has applied. Our regulator here emphasises birth numbers, so unlike other countries where midwives often specialise in one area of care, almost all midwives here work across the whole scope. This means that many midwives have a long time gap between the application and the last time they provided labour and birth care. Or it could be they've been away from practice for a while, or they've moved to Canada a few years ago and haven't practiced 5 of the last 10 years. In these circumstances, we can advise someone to get more experience before they come to Canada, or if they're able to, return to work clinically in their home country for a few months before reapplying. We can sometimes make exceptions and offer them a longer clinical placement when on the course to make up for those numbers, but we would only do this if we felt the midwife was a strong candidate in other ways. Next slide, please. So we've seen an increase in personal statements that are very obviously written by artificial intelligence. They contain all the right buzzwords that an AI would consider we want to see, but they sound inappropriate for the person applying. So the interview is a time when we can discover if the statement was self-written or not, and also when we can delve deeper into their education and experience. It's sometimes obvious when they've been a bit creative with their application, but we rarely see obviously fraudulent documents. We are thorough in checking accuracy and authenticity. Next slide, please. So no matter where someone comes from, the process is a difficult one. Not only is it hugely expensive, but it can be quite lengthy. So there's often a conflict between what we need and what the applicant's prepared to get. So some people don't want to tell their employers what they're planning, yet we need up-to-date references for their current clinical setting, for example. Because so much rests on admission, applicants get very distressed if they don't get interviewed or accepted. And for those already in Canada, it may mean they'll neither ever work as a midwife again, or they need to retrain from the beginning. For others, it may mean their immigration dreams can't be fulfilled. So the impact of our PLE assessment is huge, and a good process is absolutely essential. Thank you.
Thank you so much, Jane. Great to hear about the recognition of prior learning being used in the programme in Canada, and not just in pre-service midwifery education. So just as a reminder, there's a question and answer tab at the bottom of the screen. Questions for any of the speakers today can be asked, and we will have some time for Q&A at the end. And now we've heard some good practices regarding recognition of prior learning in both Canada and Pakistan. I just wanted to talk a little bit more about what other best practices we know about. So the Global Standards for Midwifery Education Companion Guide, which is available on our website, provide recommended selection criteria for all midwifery applicants. So these include that they can read and write the national language or the language of instruction if different from the national language. They have successfully completed courses in relevant subjects, so sciences and maths, that they can provide proof of good conduct through references and demonstrate a strong motivation to be a midwife. But when RPL is a supplementary criterion, we need to add additional best practices. So these might include rigorous and individualized assessments of prior learning and experience when necessary. So this includes considerations like an individual review of a midwifery associate's scope of practice. The definition of a midwifery associate, according to ILO, is broad, with huge variation in prior learning, knowledge, skills, and behaviours. And not all midwifery associates will be suitable for a recognition of prior learning programme, and this is where individualised assessment is necessary. So similar to that demonstrated in the case study from Canada, we need to look at each applicant individually. Flexibility in pre-service midwifery education programme admission is also needed for recognition of prior learning to work as an admission criterion. So if a programme is designed to facilitate a 0 semester, a course will be longer. We can have multiple entry points and altered course durations, like was demonstrated in Pakistan. And there also needs to be social considerations. So many applicants via the recognition of prior learning route will have caring responsibilities. They'll be required to relocate temporarily during their education programme. So provision of relocation grants and housing that supports students bringing young children will ensure these applicants remain on the course. Next slide, please. So now you know what recognition of prior learning is, we would love to know, are you using it in your setting? So hopefully a panel is coming up on the screen for you where you can vote using the panel, yes, no, or I don't know, as to whether you are using it. I'll give just a minute or so for people to complete. Great. It's great to see that there seems to definitely be a really good proportion of people already using it. So I'm hoping this means there's lots of experts. We're starting to slow down a bit, so I'm going to move on to the next poll, please, Bruna.
Steph, do you wanna share the results now of
Yes,
this?
yes, please.
Okay, so I'm just gonna end the poll and we're gonna share the results.
Great. Great, so 42%, so a small majority that out of the three are showing, but this is really good, and thank you everyone for responding. Okay, next poll. So we also want to share that we're right at the beginning as an organisation of providing guidance on recognition of prior learning. And we'd like to know, what future guidance do you think would be most helpful from ICM about recognition of prior learning in midwifery education? So hopefully this poll will show up a list of options that you can vote on. Is it coming? I quite can't see it yet.
Also note, if you choose other, you can share your thoughts in the chat.
I can't see this one. So I can't see what responses people are giving.
Okay, I'll end poll now and I'm gonna share the results.
Thank you. There we are. Okay, so a toolkit would be most helpful, followed by another webinar. Great, thank you. This would be really helpful. Next slide, please, Bruna. So to be able to create the next set of guidance, we are hoping to find experts in recognition of prior learning, and we're sharing here a link accessible through the QR code to a short form where, if you think you are an expert in recognition of prior learning, you can share your details for us to contact you for consultation in the future. I'll also share a code to the form in the chat in case you're not able to use the QR code. And with that, I'm going to hand over to Sally to chair the Q&A session. Thank you.
Thank you, Steph. And perhaps you could just move to the next slide, Bruna. So there are some questions that have been posted in the Q&A section. And I can't see at this point, I think there's some comments also in the chat, but let's start with the Q&A. And Yella's, you're asking, if a student has previously received midwifery training at the high school level and works as a midwife in a clinic, should the knowledge obtained from this education be accepted in university education? And since she works as a midwife, can her hours be counted against the specific number of hours to be calculated in lieu of a suitable course? I'm a little bit confused by the question. Yella, so my apologies. if she's already a registered midwife, and is she then looking to enter another higher level program, or is she not a registered midwife already, but has had some sort of practice experience, but does not have a formal qualification? Because those are two very different situations. And I'm just imagining, and please, Jane or Nyla may want to jump in here. If she is not yet a registered midwife, but she has had some practice and experience, it would be up to the midwifery program to make a decision as to whether or not they would offer any recognition of prior learning. I suspect that it's unlikely, but it would, again, I think recognition of prior learning has to be the decision of the educational institution, because they look at their program, they know the pathways, they know the content, and they are the ones that could then decide what they will recognise and what they will not recognise. So there isn't a global answer to this question, Yellas. I hope that helps. Sunithra has asked, we have only midwifery training from government level and registered in the Medical Council in Sri Lanka, but we don't have nursing training. What can we do? Again, I'm a little bit confused by this question. You've got midwifery, but you don't have nursing. I'm not quite clear. I'm so sorry. Does anybody else have any understanding of what that might be about?
I mean, I wonder if it's to do, most places are now going towards direct entry midwifery and don't need nursing. So I'm not sure if you're asking about the need to have nursing on top of midwifery, and the answer for many places would be no, but I think it also depends on what your midwifery training includes. And so some midwifery training may not include enough of what might come under nursing in their midwifery course. So I think that's really dependent, and I've looked at programs for all around the world and they're incredibly variable. So it would be really difficult to say outright that there's one answer. I think that just depends on the program, but no, and you don't need to be a nurse to be a midwife.
Thank you, Jane. Thank you. And then Tara Kayehu, I'm so sorry, I'm sure I'm not pronouncing that correctly. It's been difficult to get a job as a midwife with a diploma, and now those programs are no longer happening. Midwives with bachelor's degrees also do not get jobs. There is a lot of sadness regarding our profession. I gather you're in Ethiopia. What is the role of ICM in addressing these issues? I'm sorry for the challenges. Look, I'm very sorry to hear that as well. I think it's a problem in many countries. ICM, our role really is at the global level, trying to advocate for more investment in midwifery, which includes more investment in midwifery education. We are involved at the moment in a piece of work from the WHO, which is coming out now to encourage countries to invest in midwifery models of care, to build up the midwifery profession, because it's so important to saving the lives of mothers and babies and ending preventable deaths. And we try to work closely with associations about their issues in their own countries, but there is no easy answer to this. Yellas, you've got another question, but I'm just going to jump first down to Anonymous. I didn't get what RPL is. It's recognition of prior learning. So recognition of prior learning in the context of a direct entry program might be a midwife who's completed a shorter midwifery program. For example, in Pakistan, where they're talking about the lady health visitors who completed a shorter program than the one they would have now that leads to midwifery registration, those lady health visitors might get some recognition of prior learning into the bachelor's degree. So it's that kind of thing. It's about, is there a way to recognise what individual students bring with them, sometimes from other qualifications that they have undertaken. Mutbang, how is someone who intends to be a midwife assessed as a process of RPL? I think, I'm not sure again, I'm sorry for the misunderstanding, but I think the point that we want to make is that every educational institution may consider having processes of recognition of prior learning. Not all of them do, as we've seen from the polls. But if they do, their policy and their process and how they assess it will be very specific to that educational institution. The idea is to make sure that the student is getting recognised for something that is equivalent to something that they would otherwise be expected to do in the program. And that probably also goes to your other question, Motbang, because it's going to be relevant to the institutions. And as we saw from the two case studies, the two very different approaches to how this is being done. Stephanie and Kate, is there anything in the chat that we need to look at?
I was just going to come back to the question from Utilise in the Q&A about there being so many online certificates and programs, and I think I'm expanding on what you said, Sally, which is that we need to look at these at an individual level, just as Jane was describing, going right back to what is the content of this program. And I think it kind of sums up several of the questions, which is that it may be that a whole cadre program nationally is the same, like with the lady health visitors, so we know what that is. But when people are coming with lots of different aspects of recognition of prior learning, it might need to be quite an individualized process, which is, we acknowledge, quite time consuming. Thank you.
Thank you, Steve. And Elsie, I see your comment. I'm not convinced we have a lack of midwives. Many are stepping away because of work resource pressures. They would return if things improved. Of course, I think we all understand that around the world, midwives face many difficulties in their workplaces. And as much as we talk about the shortage, we also need to talk about improving the conditions and the environment within which midwives are working so that they do stay in practice and don't add to the shortage that we already have. So a very important point, thank you. I'm going to close us down now at 5 o'clock. Thank you so much, everybody, for your participation. And thank you for all the very positive comments that we're getting in the chat. I'm glad that you've enjoyed the session. Obviously, we will be doing more next year. If you do think that you have expertise in RPL, please do get in touch with us. And I wish you all a very happy holiday break. I'd like to pay special thanks to UNFPA for funding this webinar and this webinar series that we have been running. And it's been a pleasure for us from ICM. We're certainly keen to do more next year and hope that you're all going to attend. So please do have a wonderful break, and we'll see you in 2025. Thank you to all of the participants, the facilitators, the speakers, everybody, and the translators, the interpreters. Thank you so much.
Thank you and goodbye.
Thank you. Bye bye.